The question has come up about awake lipo. Awake lipo is a type of liposuction that's done strictly under minimal sedation or no sedation and local anesthesia. Liposuction has been done in this country since 1983, and the procedure has evolved tremendously since back in the 80s. One of the most important advances for liposuction, whether it's traditional liposuction or liposuction using ultrasound devices such as is that we no longer perform the liposuction dry. We perform the liposuction with large amounts of fluids placed in the tissues where we're going to do the suction. This has been helpful not only in lubricating the cannula as it goes through, it keeps the thermal temperature low when you're using devices such as ultrasonic lipo of different types, including the Vaser. It keeps the temperature down in the tissues, but more importantly, it serves as a carrier for medications. The formulas for the fluid that's placed has epinephrine, which causes vasoconstriction so that the patients bleed less and bruise less. They also have what's called TXA, which also helps with the bruising and swelling and bleeding. But more importantly, when they're done under sedation and local anesthesia, then you have to place the local anesthetic into the formula that you're injecting. And that's where it becomes a dangerous issue. Local anesthetic has a very strict toxicity dose. And for most patients, that is considered 50 milligrams per kilogram of weight. And when you're injecting the large amounts of fluids that we do in this day and age, if you adhere to that formula, then the fluids dilute the local so much that it's not an effective form of pain control during the operation. Some of the disasters that have happened with liposuction have not been secondary to penetrating the bowels or things like that. They've been secondary to patients having lidocaine toxicity. Lidocaine toxicity is extremely important because it can cause cardiac arrhythmias that can lead to cardiac failure and death. Toxicity of lidocaine is also affected by a lot of different medications. Things like anorexias, diet pills, weight control pills, anti-contraceptives, antidepressants. All these families of drugs can affect lidocaine toxicity, and it turns out that many of the patients that we treat for liposuction are on one or several of these medications at the same time. Certainly anti-contraceptives is quite common in the patient population that we do liposuction to, same as anorexians. Many of these patients have been in and out of diets before they finally get their liposuction and have been on these medications. The scary part of this is that liposuction is an outpatient procedure, and lidocaine toxicity is best gauged by what we call peak plasma levels. Those do not happen until 8 to 10 hours after the injection. Patients are not being watched by a nurse 8 to 10 hours later. This is an outpatient procedure and they're home already. So when they have those high amounts of lidocaine circulating in their system, if they're going to get toxic, it's not going to happen in a situation where they're being monitored. It's going to happen at home hours after they've arrived. They may already be somewhat sleepy from the pain medication they're taking, and if they go into arrhythmias, it may not be picked up. Well, I perform awake lipo if somebody needs a small revision, etc., because I know that the surface area I'm treating is small and the amount of lidocaine necessary to numb that area will not come anywhere near what it takes to put a patient into lidocaine toxicity.